How is secondary bone cancer different from primary bone cancer? Imagine your bones as the body's sturdy framework. Sometimes, cancer can develop in the bones themselves, or it can spread there from another part of the body. Knowing the difference is key for understanding diagnosis and treatment options. Primary bone cancer starts directly in the bone tissue. It develops from cells that make up the bone, like osteocytes or chondrocytes. These cancers are quite rare, making up a small part of all cancer cases. Common types include osteosarcoma, which often affects teenagers and young adults, chondrosarcoma, usually seen in middle-aged or older adults, and Ewing sarcoma, which tends to occur in children and young adults. Each type has its own characteristics, such as how quickly it grows and how it responds to treatment. Secondary bone cancer, also called metastatic bone cancer, happens when cancer from another part of the body spreads to the bones. This is much more common than primary bone cancer. Cancers like breast, prostate, lung, thyroid, and multiple myeloma often spread to bones. When these cancers metastasize, the cancer cells in the bones are the same as those from the original tumor. For example, if breast cancer spreads to the bones, the cancer cells in the bones are breast cancer cells, not a new type of bone cancer. The main difference lies in where the cancer begins. Primary bone cancer starts in the bones themselves, while secondary bone cancer is a result of cancer cells traveling from elsewhere. Because secondary bone cancer is more common, it often indicates that the original cancer is active elsewhere in the body. Treatment approaches also differ. Primary bone cancers are treated based on their specific type, often involving surgery, chemotherapy, or radiation. Secondary bone cancer treatment focuses on controlling the primary cancer and managing bone health, sometimes including targeted therapies and supportive care. Raising awareness about these differences helps people recognize symptoms like persistent bone pain or fractures early. It also highlights the importance of thorough medical evaluations when symptoms appear. Ongoing research aims to improve treatments for both primary and secondary bone cancers, with the goal of increasing survival rates and quality of life. If you or someone you know experiences symptoms suggestive of bone cancer, it is essential to consult healthcare professionals for personalized advice. Understanding the distinction between primary and secondary bone cancer is a vital step in promoting early detection and effective management.